My name is Joseph Otayek. I'm the Medical Center Director of AUB in Beirut. And I'm also taking care of KMC, the newly acquired hospital in Kisrwain area. I'm an AUB graduate, engineering school 1984. Then I have a degree in biomedical engineering from France. And finally I got an MBA from INSEAD some 30 years ago. AUB is the highest ranking hospital in the area because it has this very strong network of alumni, physicians. We apply all the policies and procedures that are applied in the US. In the US system, there is a lot of, everything is written beforehand. There are policies, there are procedures for everything. So that's why I think AUB is the leader and is far more developed and advanced than any other hospital in the region. Everybody in the healthcare sector can have trouble, can make mistakes, can have accidents. But when you have a strong system, you can easily overcome the accident. While when you don't have a strong system, you are really at the mercy of any incident, any problem. And that's why AUB is positioned on this matter better than any other institution in the region. When I first joined the AUBMC in 2020, we were at the beginning of the financial crisis in Lebanon of the revolution. As soon as we started taking our breath, we had the COVID pandemic, and AUB was the only hospital in Lebanon to accept really everybody. Then we had the August 4 blast, which left our city almost destroyed, with mainly also the morale destroyed. A huge number of physicians, of nurses, of healthcare professionals left Lebanon right after this explosion because it was really very, very traumatic. So after this, we had the Gaza war that impacted us. We had last year the war on Lebanon, and even now when we think that things are going better, we are not really quiet, and nothing returned back to its original situation. So it was really a very challenging period. We became a little bit more, what the president liked to call it, anti-fragile constitution. We were able to cross-train people to reduce the really very deep specialization, but to have people do different type of work so that we become much less sensitive to any major blow or change. The second point that also changed, we reduced a little bit the layers of hierarchy. So the top management were much more close to the ground. The executive team that works with me at the hospital spend much more time on the ground with the staff, on the front line with the patients. And that's also a change that we introduced to make things more efficient. When we are in a hard situation, in hard times, we cannot afford to wait for all the hierarchy organization to react. We have to be much more reactive. During the financial crisis, any other system in the world would have collapsed completely. But what we succeeded to do, and I think AUB was at the first line of this action, we developed a new type of collaboration with the insurance companies, which are the financiers of the whole healthcare system, the physicians that are the major providers, and other hospitals, to be able all together to save the Lebanese healthcare system. What I'm really excited about is exactly changing this rules of the game. We used to live in a world where we used to have capital expenditure, we had to have investment coming from the university or from banks. The Lebanese healthcare system, mainly the major investment were financed either by borrowing from the bank or by funds coming from the university. Now the university have a lot of other areas to spend in while our revenues decreased. We are trying to develop partnership with the supplier of medical equipment so that they also have skin in the game, and all together we try to continue improving and investing, and we are succeeding. We are installing at AUBMC the latest technology in radiotherapy. We installed the adaptive radiotherapy, which is the second machine in the whole region. We just installed the latest version of the robotic surgery, and we are planning now also to invest in the scanner with photon technology, which is the latest in the world. There's no other machine installed in the whole Middle East. So we are really still at the edge of the technology and at the forefront of the technique, while we have to completely transform our financing system, otherwise we'll not be able to reach those goals. And I think that's the major challenge, and that's the major change that will introduce in the whole system.